Joining us now from the Baltimore Humane Society is Wendy Goldband with little Matilda, who is looking for a good home. Tell us all about Matilda. She's awesome.
Matilda is what we like to call a puggle. She's a combination pug beagle, and she is 9 years old. So
Look at her little
gets our senior discount.
Aww.
And she's just a sweet dog. Lots and lots of energy. She has lived with other dogs, so she will probably be pretty good in most any household.
Good. Do you know she's good with cats?
That I am not sure of, but we can always help and get her acclimated.
She seems really friendly and she's very curious. I'm going to give her a little bit of a lead there, but I was trying to keep her kind of still so the camera can get a good shot of her. She's looking around. She's alert. She seems very friendly. Loves to be petted.
Yes, she is very high energy from what I've had with experience with her so far, and she even figured out how to lower the windows in the car. So.
Oh my gosh, she's smart too. You have so much going on right now at the shelter.
Tons. So next Saturday we have a bar crawl up in Towson. So anybody who'd like to join us, it's only $5 with tickets online.
Ooh, that's a really good price.
Yes, very good deal.
And you have Giving Tuesday?
Yes, we have Giving Tuesday. That is the Tuesday after Thanksgiving, and it is when nonprofits try and remind all you shoppers that the holiday season is just not about shopping, it's about giving. We're celebrating our 90th birthday. So we're pretty excited. That's 90 years of saving animals.
That is really, really awesome.
Yeah. So we're asking for people, please donate to help us continue our quest. And also, anybody who donates $50 and up will get a party favor from us, a nice party favor, a stuffed animal dog, or the choice of a puppy or kitten lunch bag. So we have some fun party favors. And then on December 2nd, we have our holiday open house.
Oh, great. So anyone can come?
Anybody can come. Pet and family pictures with Santa. We are going to have a pet blessing, non-denominational pet blessing for anybody who wants to bring their pet that day. We have story hour, animal themed with the Baltimore County Library, and all sorts of fun things going on.
All right. Well, hopefully Matilda will be long gone from your shelter by then. If you are interested in adopting her, go to the Baltimore Humane Society. You can go to BeMoreHumane.org or give them a call at 410-833-8848. Wendy, thanks so much for joining us.
Thank you.
You're welcome. Stay with us. More news is coming up next. First, though, here's a look at last night's winning lottery numbers. Good luck.
Welcome back. Sign-ups for coverage under the Affordable Care Act are on track with previous years, according to new numbers from the government. The government says that more than 600,000 people signed up in the first week of open enrollment season. Nearly a quarter were new consumers. President Trump has repeatedly tweeted that Obamacare is collapsing or imploding. He stopped payments that reimburse insurers for providing lower copays and deductibles to low-income people. Open enrollment closes December 15th. Well, Irene Myers-Thompson, Regional Wellness Director for United Healthcare of the Mid-Atlantic, is joining us today to discuss this, and she has some tips to make that process a little less daunting. Good to have you, Irene.
Good morning, Theo. Thank you for your time.
Of course. So let's start there. I mean, why is it such a daunting and challenging process?
Well, you know, I spent my career in this industry. It's not really interesting, is it?
No.
So it's that time of year where you kind of have to force yourself to look at paperwork. It's just not an exciting type of topic, but when you think that healthcare is really in top three, when you think top of mind for Americans across the country. So give yourselves a gift of time. Use those 2 weeks that usually designate open enrollment. When United Healthcare conducted our consumer sentiment survey earlier this year, we found that only about 9% of the respondents actually knew what a premium was, a copay, a deductible, an out-of-pocket maximum. So give yourself the opportunity to talk with your carriers when they come on site and learn a little bit more to make it easier for you.
Yeah, so let's talk about embracing the situation. How do we do so?
Yeah, so think about your budget and your family. Everyone has unique needs. So budgets are different, families are different. Think about instances where a child may be getting braces next year. So look at those additional services like flexible spending. Really, is my provider in the network or all the hospitals part? Absolutely. You want that comfort. No one wants to have to change their doctors. do comparisons. If your employer offers you multiple plans, kind of lay them side by side. What are the co-pays? What is the out-of-pocket maximum? United Healthcare, this year, we know we need to do a better job teaching everyone because everyone's lives are busy, so we built a website, uhcopenenrollment.com. Anyone can go to that website and really walk themselves through a Healthcare 101 scenario. What should I know? Even for people moving to Medicare or thinking about retirement and becoming Medicare eligible. So putting all those very simple educational tools out there online for people are really very key, and just trying to make it accessible to them because everyone's busy. So we're trying to use the gift of technology to help people make better decisions.
Yeah, and also don't wait till the last minute. That can be key.
And a lot of people do, and the Human Resources Department will tell you that we always have those few stragglers towards the end, but use those. Typically for employers, they give a 2-week window for you to learn your benefits. When your employers make the effort, and many of them do, to bring the carriers on site for a day in a lunchroom or a break room, give yourself the time to go down there and literally just look at them and say, what is new? What has changed? Are there any new resources I need to know about? Our United Healthcare families now have access to virtual visits. So you can Skype with a doctor that can even call in prescriptions when your doctor's office is closed. So avoid going to an urgent care, and more importantly, that emergency room when it's something that can be handled.
All right,
quickly.
Irene, a wealth of information there.
Thank you.
Thank you so much.
Thank you so much. Take care.